So be aware, very soft toothbrushes can be very damaging because they are not adequately helping you or your gums to heal themselves. Now, you may want to ask first, how can a soft toothbrush and gentle brushing actually be a problem? You don't need more and more cleanings. You need to massage your gums with an adequate toothbrush. So should you use a hard or soft toothbrush? Did your dentist tell you to stop brushing so hard, or tell you that you are brushing so hard you're damaging your gums, hurting your enamel? Maybe your dentist has suggested a soft, usually expensive electric brush to solve the problem. Now, electric toothbrush studies are shipped around to dental offices everywhere, and they really are convincing. They choose people who have disease and plaque problems, and they give these people a manual brush and an electric brush. And of course, an electric brush is going to be better because they don't know how to brush their teeth. But I say that in the hands of a motivated patient, and motivated is the word, an electric toothbrush is not going to be your answer. And it actually can not only lead you into a false feeling of security, but also into later damage. I recommend a flossing manual toothbrush. Now, you may want to ask first, how can a soft toothbrush and gentle brushing actually be a problem? This is because gums need to heal every day. And in order to heal, we have to stimulate a wound response, a healing response. And that will not be generated by a soft toothbrush. A healing response we'll talk about later, but basically you are trying to stimulate your gums to rejuvenate themselves, to repair themselves. We have to take away any infection, and that's done by massaging the gums so that the lymphatics, the liquids in your gums, will take away the bacteria you don't want, gets rid of the inflammation. Then the capillaries that are there will regrow, bringing stem cells to actually repair and regrow your gums. So your gums need this kind of adequate care, and it cannot be provided by a soft toothbrush. So this can take years before you see these new problems. The problems will be pocketing around your teeth. And you may not see these, particularly if you are healthy and younger, for 5 to 10 years. If you're older and you start using a soft toothbrush, you'll probably see those problems sooner. So be aware, very soft toothbrushes can be very damaging because they are not adequately helping you or your gums to heal themselves. And there's no other way to get pockets to actually heal and your pockets to heal up so that you have no more gum disease, no more pocketing. You don't need more and more cleanings. You need to massage your gums with an adequate toothbrush. And brushing isn't easy. And you need a brush that will help you get to all these areas. You need a brush that's sufficiently resilient. And again, one that's too soft just won't do the job. You have to get rid of plaque on your teeth, and you have to bring toothpaste to your tooth surfaces. That's what brushing is about. 3 things: gum massage, applying toothpaste to the surfaces of your teeth, toothpaste that's going to harden them, and get rid of any plaque or dead plaque that's lying around on your teeth. And for that, you won't do it adequately with an electric or very soft toothbrush. So when you start brushing your teeth, you need to know that there are always important places in your mouth that for you may be difficult to reach. And these places must be brushed. They have to be taken care of. And they are so often missed every single time you brush. As a dentist in practice, I didn't have a hygienist. I would look at my patients. I would try to figure out why they had disease. I recognized that people with dirty toothbrushes, often it was a situation where somebody wasn't thinking, or maybe after tragedy, they weren't paying attention. They had other things on their mind. Dirty toothbrushes can really infect your gums. And because I didn't have a hygienist, I used to do disclosing solution and actually see, because disclosing solution colors these areas. And I could see where people missed. And I tried to figure out why. Why did they always miss that same area every day? Why weren't they removing plaque better? You see, if you're a sugar eater or you're a snacker, you will feed sticky plaque. Snacking and sipping does that. The plaque gets stickier, and to loosen that plaque, you may need something beyond a toothbrush. That's where xylitol comes in. Regular use of xylitol, and I go through this in many other videos, will actually loosen the plaque on your teeth, so you will do a better job of removing it. So can you harm your teeth by brushing them? Oh, yes. If you're brushing your teeth in an acidic environment, if your enamel has been softened by acidity, it's easy to brush it away and form a channel that looks like you caused it. But it wasn't the brushing, it was the acidity. Or perhaps you're using an abrasive toothpaste. Or perhaps your timing is wrong. Or you just whitened your teeth. These are the reasons that your enamel can be soft. You see, healthy enamel is hard, has a Mohs hardness of 5. Stainless steel is 4.5. But if you sip acidic drinks or fizzy drinks all day long, your enamel can be as soft as 2.5. That's as soft as a fingernail and easily abraded. If you eat, say, 3 or 4 times a day, and you allow an hour of damage after every single meal, you have 3 to 4 hours of damage, acidic damage, happening to your mouth. If you do that every day, don't be surprised that you have cavities that don't heal. Don't have to be surprised if you've got gum disease or more plaque or calculus forming. We have to stop these long periods of acidity that will damage your teeth and promote bad oral health. And the way to do this is either to have a system, a strategy where you can brush your teeth straight after meals. Now, I have a strategy. My complete mouth care system is a strategy that allows you to brush directly after meals. If you use a Miswak stick, if you live in the Middle East or Africa, you may be very familiar with a Miswak stick. This is a stick that you can use directly after meals to brush your teeth because it will deal with the acidity in your mouth. And the other technique, if you don't want to use my system or a Miswak, is to oil pull. If you are somebody who oil pulls, you don't have to wait an hour. You can oil pull directly after eating, and your teeth will be safe then. When you spit out the oil, you will then be able to massage your gums safely. So these are the techniques that I recommend that you consider so that you don't spend this ridiculous hour leaving your teeth to be damaged by acidity at the end of meals. Now, the other way to deal with this is to use xylitol or a tooth protective food directly at the end of your meal. These foods, it can be an avocado, cheese, whole milk. You can eat an apple, any of the fruits that contain xylitol, like raspberries and strawberries. If you have these foods at the end of a meal, they will alkalize your mouth and limit damage, stop the acidic damage. And if you're using xylitol, it will actually pull a flow of healthy alkaline saliva into your mouth. And this saliva is going to repair any minerals that were lost during eating. The saliva will have cells in it that specifically help heal and get rid of infection around teeth. So if you have gum disease, that would be a wonderful thing to do. And then you won't be leaving your teeth or your mouth at risk for acidic damage, destruction. So just to recap, it is acidity that is a problem. So either use a brushing system like my complete mouth care system that protects your teeth. We have a pre-rinse that's called closis that you use first. This gets rid of the acidity so you can brush safely. Or you could use some other strategy like a Miswak or oil pulling, which doesn't leave your mouth at harm's way for an hour. Or you can use a food that's tooth protective like xylitol. And xylitol is probably the absolute best because it not only protects your teeth from acidity, but it will feed the good bacteria in your mouth. And what you want to do is stop eating and drinking for an hour after meals so that this xylitol in your mouth can actually promote not only good bacteria that are to get rid of plaque, but also the bacteria at the back of your mouth that when you have eaten a healthy meal will interact with the healthy saliva in your mouth to form nitric oxide. Now, what does that do? You will find that an hour after your meal, if you haven't eaten or if you give up the coffee, you're not sipping or snacking anymore, you just leave that solution of xylitol in your saliva. You don't have to keep it in your mouth. Just don't eat or drink afterwards to wash it away. And you will find that you may lower your blood pressure, improve your breathing, and actually feel more alert. It helps your cognitive function. So these are things way beyond teeth. This is going to help your health. Eat, drink, and then find a protective way so that you do not leave your teeth at risk for acidic damage afterward. So is it all about the toothbrush that you use? Is a soft brush better than a hard brush? No, you need an effective brush. And that effective brush I recommend is as a flossing toothbrush. It's one that has plenty of bristles. It has a dense head, and the bristles are of two lengths, some longer than the others. I recommend that you have two, so they have 24 hours to dry between uses, and that when you brush your teeth, you are aiming specifically at all the regions where plaque accumulates. And we'll do other videos about this. So subscribe, get on my channel, and learn how much there is to know about that simple habit of brushing your teeth.